Valentine's Day is also National Donors Day. The need for organ and tissue transplants and the shortage of donors affects people of all ages and ethnic backgrounds. However, due to staggering rates of heart disease, high blood pressure, and diabetes among people of color, African Americans comprise nearly half of all the people on the national waiting list. Nationwide, there are over 32,000 African Americans on the list, but last year there were only 4,400 minority organ donors. I recently sat down with Ruben Wright of LifePoint to talk about this issue. Ruben, thanks for sitting down with us today. Tell us a little bit about your organization and what it is you exactly do for the organization.
LifePoint is the federally designated organ recovery program for the entire state of South Carolina. We also procure or recover tissues such as eye tissue, which is cornea and sclera, but we also recover skin, ligaments, tendons, bone, all with the intent of transplantation.
Okay.
And we've been established as a nonprofit since 1986.
Okay. So give us a little understanding about the company's mission and what the organization is here for.
Our mission is to, together, we want to save lives. Okay. Currently, right now, we know there's about 120,000 people waiting for transplantable organs in this country. And about 1,000 people right here in South Carolina are waiting for a second chance at life. The thing that really is concerning us is that on our kidney transplant list, 90% of those people are African American people. And so while we're out here doing the outreach is to raise the awareness about the importance of African Americans actually becoming donors. Currently now on our South Carolina donor registry, even though the donor registry has 1.1 million people, only 17% of the people that are on that list are African Americans. We also know that there are patients that are only going to have a successful match if their donor comes from their own ethnicity. Okay. And so we do want to try to raise the awareness about that, and we want to get as many African Americans on that donor registry as possible so that we can actually impact our people here in the state. We're actually higher than most states as far as African Americans. We have about 30% of the people in that national waiting list are blacks. Okay. But here, we have about 90% of our people waiting for kidneys are blacks. Wow. So we are really in desperate need.
So what are some of the factors that factor in why African Americans, why that number is so high?
I think, well, one of the things we also know, we know that diabetes and hypertension are running rampant in our community, specifically here in South Carolina. And one of the statistics that really has been alarming is I found out that currently 40% of the people who are on dialysis did not know that their kidneys were failing till they actually 1 week before they actually got on the dialysis machine, which completely surprised me. But we do have a lot of African Americans because of diabetes and hypertension that are listed. Then the next thing we have is there is lack of awareness. So many times African Americans don't know that there's so many of us that are on that list. There's also a lot of misconceptions about donation. Like, does donation disfigure the body? Can you still have an open casket funeral if you do an organ donation, or can you do a tissue donation? Can you still do that? Yes. Sometimes there are religious issues. Some people feel that somehow one of our favorite quotes that we've used over the years is, don't take your organs to heaven. Heaven knows we need them here. And many times there's African Americans feel that somehow that I came down to the earth with everything, so I want to go back with everything. So there's a lot of those kind of misconceptions out there, and I think that's been a lot of the things that have kind of slowed up our donation process.
What is the organization doing to kind of dispel some of those myths? Do you guys have a community education program in place, or how could someone find out more information?
Well, one of the things we have is we work very closely with Donate Life South Carolina. They're actually the organization that actually holds and operates the South Carolina Donor Registry. And we do a lot of programs. For the last 2 years, we've done the Black Expo here in Columbia, Charleston, and Greenville. And of course, we have formed a cultural affairs committee just so that we can start brainstorming the ways that we can properly be able to outreach and educate our people about the importance of giving.
If someone wanted to donate, how would they go about that process? And could you explain to us, is it a blood test you got to take, or is it a series of tests? Explain that process to us.
It's actually very, very easy. You can go to if you're time to renew the license, or maybe to obtain your license for the very first time, or if you're going to change your address, you can go to your local DMV, and actually you can register to be a part of the donor registry that way. Or you can always go online and go to donatelifesc.org, donatelifesc.org, and it's a very simple process to actually have your name added to the South Carolina Donor Registry. And at the time that someone does die, that information is available for the hospital as well as for LifePoint. And then we approach your family and ask the family, did you know that your loved one wanted to become a donor? And most families, because that is what the individual wants to do, they'll support that wish.
Okay. Now, as far as kidneys, giving a donation, living donors, what about that process?
That is one of the, I think, in the scope of trying to recover as many kidneys, because we know there's just so many people in this country. I think that is the highest organ, or the most needed organ in this country, as well as in South Carolina, is kidneys. Living donation is another alternative, again, to get people transplanted and off that list. They do what we call living-related donation, which is somebody within your family chooses to be tested and donate a kidney to someone who needs. Or it's non-related kidney donation, which is someone who's a perfect stranger or a neighbor or a good friend chooses to be tested. And so both of those procedures actually have been a tremendous help in getting more organs, well, specifically kidneys for African Americans.
Now, when you're dealing with living donors, do you have to be tested, blood type, and that stuff? That's the process we're on. What about that process?
Absolutely. It depends. Medical University of South Carolina in Charleston actually does that for South Carolina. They provide those kind of services because it is very, very matched, close to blood, tissue typing, and what they do is, if the person who's being tested has maybe a history of hypertension or maybe kidney disease, that would pretty much rule that person out. So there's a lot of factors that go in before you actually can become a good candidate to become a part of that living-related or non-related kidney donation process. But it's very, very important because it really has made the difference. We know that for kidneys, there's only like 1% of all our death fall into the category of brain death. Brain death meaning you can actually become a vital organ donor. Most people die of heart failure, some cardiac death. And so there's only going to be a smaller percentage of those people who can actually give, who become a donor. Mm-hmm. But with the living-related or non-related donation, as far as kidneys are concerned, it opens up the possibility for more and more people to get access to have a second chance at life.
Okay. In recent years, we've seen the rise of dialysis clinics, especially in minority neighborhoods. Is that a sign that things are getting better or worse?
It's probably getting worse. I've actually worked for the organization and doing this kind of work within the community for about 21 years. Mm-hmm. And it seems to be that the percentage of African Americans in dialysis clinics have increased. Mm-hmm. One of our donor families in the upstate is a dialysis nurse. She says currently about 90% of the patients that actually come in for treatment services are African Americans. And so I really think when I first started, it was probably right about 70 to 75% down in the Charleston area. So it has kind of slowly increased over these last couple of decades. And I think it's very, very important for African Americans to be very proactive where their health is concerned, as far as eating right, low sodium content in food, exercise, visit the doctor regularly, because because all of that will help to kind of curtail people being added to that transplant waiting list.
All right, Ruben, if someone wanted to get in contact with you or find out more information, how would they go about doing that?
They can actually go online. Our website is lifepoint-sc.org, or they can go to donatelifesc.org, and both of our organizations work together hand in hand. And of course, that's the easiest way. Or if they want to just give us a call on our toll-free number, which is 1-800-462-0755, they'll find us.
Thank you.
Very good. Thank you, sir.